Welcome. In this presentation, you'll learn about life after a stroke, what changes to expect, common challenges like fatigue and emotional shifts, and ways to manage them. We'll also cover important tips for recovery and the support available to help you on your journey. Before we begin, a quick reminder you can pause or rewatch this video at any time. Feel free to stop and take notes whenever you need, and remember, you'll have a chance to ask questions during your follow-up call at the end of the presentation. Let's start by looking at a few key words you'll hear throughout the presentation: fatigue, depression, and recovery. These are important topics that many people experience after a stroke, and understanding them will help you better navigate your own journey or support someone you care about. Let's take a moment to review before we cover new material. B fast is an easy way to remember the signs of a stroke. B is for balance. Is the person's balance off? E for eyes. Is the person having trouble seeing in one or both eyes? F is for face. Check if one side of the face is drooping. A is for arms. See if one arm is weak or numb. S is for speech. Listen for slurred speech. And T is for time. And most importantly, if you notice any of these signs, don't wait. Call 911 right away. Being stroke smart means knowing what to look for and acting fast. Now I want you to take a moment and think about these questions. Have you noticed any changes in your own life after a stroke? And have you found any ways to manage those changes? Take a few seconds to reflect on this. There is no right or wrong answer, just your personal experience. You can explore these ideas more during your follow-up call today. Life after a stroke can feel very different from before. You might find it harder to sleep, get tired more easily, or notice changes in your emotions like feeling down. Moving around could feel tougher too, and sometimes recovery can seem like it's taken forever. These are all common experiences, and understanding them is the first step to managing life after a stroke. Have you noticed any trouble sleeping since your stroke? You're not alone. More than half of stroke survivors have difficulty getting enough sleep. Not sleeping well can lead to problems like falling asleep at night, trouble remembering things, or feeling sad or depressed. Sleep issues like insomnia and sleep apnea are also linked to a higher chance of having another stroke. So it's really important to pay attention to your sleep and talk to your doctor if you're having problems. So let's take a look at insomnia after a stroke. Insomnia means having trouble falling asleep or staying asleep through the night. Because of this, you might feel really sleepy or drowsy during the day. The good news is that there are ways to treat insomnia. Sometimes doctors can prescribe medicine, and other times, making changes to your daily routine can help encourage better sleep. If you're struggling with insomnia, don't hesitate to reach out for support. Another common sleep problem after a stroke is sleep apnea. This happens when your breathing stops and starts while you're asleep. You might notice signs like loud snoring or choking or even gasping during the night. Sleep apnea is important to treat because it can increase your risk of having another stroke. Doctors may recommend using a CPAP machine, which helps keep your airway open while you sleep. Sometimes changing your diet or how you sleep can also make a huge difference. Sometimes after a stroke, your body's natural sleep cycle can get out of sync. This is called a sleep-wake cycle disorder, where it is hard to follow the usual patterns of feeling awake during the day and sleepy at night. If this happens, treatments like bright light therapy or melatonin might help reset your internal clock. If you're concerned about your sleep patterns, be sure to talk with your doctor. They can guide you towards the right support. Now let's talk about something many people experience after a stroke: fatigue. You might find yourself feeling very tired even when doing everyday activities that usually feel easy. It can be frustrating, But understanding why you feel this way is the first step in finding ways to feel better and have more energy. There are a few common reasons why you might feel tired after a stroke. First, you may simply have less energy. This happens if you are not sleeping well or if your medications cause side effects. Secondly, you might be using your energy in new ways because everyday tasks like eating or bathing take more effort than before. Third, feeling sad, frustrated, or worried can also drain your energy. And finally, fatigue could be a sign of depression. Depression is something to watch for and important for you to talk with your doctor about. Take a moment to consider these questions and answer them for yourself. Why do you think you might feel more tired after a stroke? And another important question, can emotional changes happen because of a stroke? These are good things to reflect on, and you can always talk more about them during your follow up call. Emotional changes are really common after a stroke, and it is important to understand them. One of the most common feelings people experience is depression. This can happen because of the big life changes a stroke brings. Family history or social factors, or even damage to certain parts of your brain. Signs of depression including feeling sad, empty, or worried, staying away from people or activities you used to enjoy, having thoughts of hurting yourself, or changes in your eating and sleeping habits. If any of this sounds familiar, remember you're not alone and help is available. Depression after a stroke is something many people experience, and it can happen for different reasons. It might be because of the big changes a stroke brings to your life, family history, or social factors, or even damage to certain parts of your brain caused by the stroke itself. Some signs to watch for include feeling sad, emptied, or worried, avoiding people or activities you used to enjoy, having thoughts of hurting yourself, or changes in your eating and sleeping habits. If you're feeling depressed after a stroke, there are effective ways to get help. Sometimes doctors prescribe antidepressant medications that can help you balance the chemicals in your brain and improve your mood. Therapy or counseling is a great option. Talking with a therapist can help you understand your feelings and ways to cope with the changes you're facing. One type of therapy called cognitive behavior therapy, or CBT, teaches you how to recognize and manage thoughts and feelings that might lead to actions you don't want. And remember, just talking to a trusted friend, family member, pastor, or someone you feel comfortable with can be a really important first step. You do not have to go through stroke recovery or depression alone. Did you know that about 20% of stroke survivors experience anxiety? Anxiety means feeling worried or nervous without being able to find a clear solution. Anxiety can show up in different ways: feeling tired, having trouble focusing, or even feeling panicked. You might notice physical signs too, like a fast heartbeat, shaking, feeling sick, or tight muscles. It is also common for anxiety to happen alongside depression. If any of these sound familiar, it is important to talk with your healthcare team so they can help you manage these feelings. After a stroke, it is very common to experience strong emotions of all kinds. You might feel anger, which can sometimes be linked to where the stroke happened in your brain. Some people also notice impulsivity, which means acting without thinking, especially if the stroke affected the right side of their brain. This can make it harder to focus, remember things, or make safe choices. No matter what emotions you're feeling, it is important to talk with your loved ones and doctors. Sharing how you feel can help you find ways to heal and move forward. Before we continue, I have a few more questions for you to ponder. How do you think a stroke might change the way you move, like walking? And what kinds of challenges do you think someone might face after a stroke? Take a moment to think about these. There are no right or wrong answers, just your own experience and thoughts. After a stroke, a lot of people find it hard to move like they used to. The most common issues are weak muscles and difficulty controlling one side of the body, called hemiplegia. Other challenges can include paralysis, balance problems, and stiff or tight muscles called spasticity. Paralysis after a stroke happens because the nerves that send messages from your brain to your muscles stop working properly. Our muscles have to get those messages from our brain to work, and when the link is cut off or damaged, those messages don't get through. Because of this, your muscles or groups of muscles can't move on their own. In fact, up to 90% of stroke survivors experience some form of paralysis. This is very common after a stroke, but with rehabilitation therapies like occupational and physical therapy, many people can regain some movement over time. Many people experience balance problems after a stroke. There are two main types: static balance, which is staying steady while standing still, and dynamic balance, which means staying balanced while moving. When one side of the body is weaker, it can be harder to stay upright, and poor balance can increase the risk of falling. Up to 40% of stroke survivors fall in the first year. Another common movement challenge after a stroke is called foot drop. This happens when you're unable to lift the front part of your foot after a stroke, causing your toes to drag on the ground as you walk. It is caused by nerve damage and can affect one or both feet. For some people, it improves over time, but for others, it may be permanent. Using a brace or special support can really help make walking easier if you have foot drop. Spasticity is another result of a stroke, and it is when your muscles become stiff, making it harder to move. You might notice things like a clenched fist, bent elbow, stiff knee, or pointed foot because of muscle spasms. There are treatments that can help, such as injections to block the nerve causing the spasms, or special therapies like ITB, which is also known as intrathecal baclofen therapy, which involves a surgical implant under the skin that delivers medications directly into the spinal fluid to ease severe spasticity. Recovery after a stroke looks different for everyone. Most progress happens in the first 3 to 4 months, but improvement can continue for years after. Therefore, it is important to be patient and keep working towards your goals. During your recovery period, a dedicated team of professionals will support you in reaching your goals. Your recovery team consists of doctors who are key in managing and coordinating your long term care, keeping an eye on any chronic conditions you may have, like diabetes or high blood pressure, which can affect your recovery. Nurses play a big part too. They help you adjust to life after a stroke, managing health problems that could impact your progress. They also provide training and guidance to your family and caregivers so everyone knows how best to support you. Physical therapists focus on helping you relearn movement skills such as walking and keeping your balance. If you need assistive devices like canes, walkers, wheelchairs, they'll teach you how to use them safely and effectively. Occupational therapists work with you to regain independence in daily activities. This includes relearning how to dress, bathe, cook, garden, and do household chores. They also look at your home environment and suggest changes, like removing barriers such as grab bars, toilet seats, transfer benches. These things make it safer and easier for you to move around. Speech language therapists work with you on improving difficulty related to speech, writing, reading, or understanding words. They help you relearn how to use language and develop alternate ways to communicate if needed. They also assist with swallowing issues, such as ones common after a stroke. Dietitians guide you on healthy eating habits and special diets to support your overall health and recovery. And finally, case managers play a crucial role in coordinating your care. They facilitate follow up acute care and ensure all the different healthcare professionals involved in your recovery are working together smoothly. Together, this team supports you every step of the way to help you heal and regain your independence. Throughout your recovery journey, you might wonder, why am I not recovering like that person? It is important to remember that stroke recovery is different for everyone. Every stroke is unique, and so is every recovery journey. Several things can affect how you recover, like where the stroke happened in your brain, when it happened, your health before the stroke, the support you have from your family and caregivers, and the type of quality of therapy and treatment you receive. So, try not to compare yourself to others. Focus on your own progress and what works best for you. Now that we've talked about recovery, here are some helpful tips to keep in mind as you work towards your goals. First, try to set realistic goals to help track your progress and celebrate each step forward. It is also a great idea to write down your accomplishments so you can remember how far you have come. And remember, if anything is unclear or you have questions, don't hesitate to ask your doctors or therapists. They're here to support you every step of the way. Before we wrap up, let's go over some big ideas to remember. First off, recovery after a stroke isn't something you do alone. There's a whole team of health professionals and sometimes other professionals who are here to help you along the way. So don't hesitate to lean on them and ask for support. Finally, recovery from a stroke looks different for everyone. So focus on your own progress and be patient with yourself as you move forward. This brings us to the end of our last session. Thank you so much for your attention and time. Please write down any questions you have in your workbook so you can talk about them during your follow-up call after this presentation.